Measles is a highly contagious viral infection caused by the measles virus, paramyxovirus family. It primarily affects the respiratory system and spreads through airborne droplets when an infected person coughs or sneezes. Measles is preventable through vaccination, MMR measles, mumps, and rubella vaccine, but it remains a major health concern in areas with low vaccination rates. Symptoms of measles. Symptoms typically appear 7 to 14 days after exposure and develop in stages. 1. Early symptoms, first 3 to 5 days. White tick mark, high fever, often over 104 degrees Fahrenheit, 40 degrees Celsius. White tick mark, runny nose. White tick mark, red, watery eyes, conjunctivitis. White tick mark, dry cough. White tick mark, sore throat. White tick mark, fatigue, and loss of appetite. 2 Koplik spots, 2 to 3 days before rash. White tick mark, small, white spots with a bluish center inside the mouth, cheeks and throat. White tick mark, a unique early sign of measles. 3 Measles rash, appears 3 to 5 days after first symptoms. White tick mark, begins as flat, red spots on the face and behind the ears. White tick mark, spreads downward to the chest, back, arms, legs and feet. White tick mark, spots may merge, forming larger blotches. White tick mark, lasts about a week, then fades as skin peels slightly. 4 Recovery phase. White tick mark, fever subsides. White tick mark, rash gradually fades. White tick mark, weakness and lingering cough may persist for several weeks. How does measles spread? Measles is one of the most contagious diseases. It spreads through cloud, airborne transmission, virus-laden droplets from coughs/sneezes. Direct contact, touching contaminated surfaces, virus survives up to 2 hours in the air or on objects. Person to person, close contact with an infected individual. Light bulb, contagious period. A person can spread measles 4 days before the rash appears and up to 4 days after. Who is most at risk? Black exclamation mark, unvaccinated individuals, especially young children. Black exclamation mark, pregnant women, higher risk of complications. Black exclamation mark, people with weakened immune systems, HIV/AIDS, cancer patients. Black exclamation mark, malnourished individuals, especially those lacking vitamin A. Complications of measles. Measles is not just a rash, it can lead to serious complications, especially in young children and immunocompromised individuals. Police light, common complications. Ear infections, can lead to hearing loss. Severe diarrhea, and dehydration. Pneumonia, most common cause of death from measles. Encephalitis, brain inflammation, 1 in 1,000 cases. Police light, rare but deadly complication. SSB, subacute sclerosing panencephalitis, a fatal brain disease that can appear years after measles infection. How is measles diagnosed? Doctor's examination, based on symptoms, rash, fever, Koplik's spots. Blood test, detects measles antibodies. test tube, throat or nasal swab, confirms virus presence. Treatment for measles. Crossmark, no specific antiviral treatment, measles must run its course, but supportive care can help relieve symptoms. Supportive treatments. Black tick mark, rest and fluids, prevents dehydration. Black tick mark, fever reduces, acetaminophen, or ibuprofen, reduces discomfort. Black tick mark, vitamin supplements, can reduce severity and risk of complications, especially in malnourished children. Black exclamation mark, severe cases may require hospitalization, especially if complications develop. Prevention, the measles vaccine, MMR. White tick mark, the MMR vaccine is the best way to prevent measles. Syringe, vaccine schedule. First dose, at 12 to 15 months old. Second dose, at 4 to 6 years old. Adults born after 1957 should ensure they've had at least one dose. Africa, herd immunity. At least 95% vaccination coverage is needed to prevent outbreaks. Unvaccinated communities are at high risk of outbreaks. Final thoughts. Measles is a highly contagious but preventable viral disease. While symptoms like fever, cough, and rash are common, serious complications can arise. The MMR vaccine remains the most effective way to protect against measles and prevent outbreaks. If you suspect measles, seek medical attention immediately. Africa.